COVID-19 has turned the world upside down, and although prevalence may wax and wane where we live, we're going to have to get used to living knowing that it's out there. So we're going to have to develop new routines and habits in order to minimize our risk of getting sick. So we can't eliminate our risk, but we can minimize it. And when developing habits that stick, simplicity is key. So on today's podcast, we have internist, author, and habit expert, Dr. Monique Tello, who has previously been on our show to discuss her book, Healthy Habits for Your Heart. We talk about staying safe in the grocery store, actionable advice we can give our patients to decrease their risk of having COVID-related complications, how to work physical activity into the day, and why we should consider getting a pet. Dr. Tello is a primary care physician at Mass General in Boston and an instructor at Harvard Medical School. She practices part-time internal medicine at Women's Health Associates, a small MGH-based primary care practice with all-female providers that serves predominantly female patients. She's originally from the Boston area and graduated from Brown University and the University of Vermont College of Medicine. She completed a Med-Peds residency at Yale, and after residency, she earned an MPH and GIM research fellowship at Hopkins. She writes a popular blog, generallymedicine.com, about her life as a doctor and a mother, and contributes to many other blogs, including Mothers in Medicine and the Harvard Health blog. Her writing focuses on work-life balance and a healthy lifestyle.
Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing Krebs cycle. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of their respective employers. And now, here's Dr. Bradley Block.
Shopping for disability insurance can be complicated and time-consuming. Wondering if you're getting the best prices and discounts while in training can make the process even more overwhelming. Pattern believes doctors have more important things to do than spending hours sorting through numerous insurance options. This is why thousands of doctors trust Pattern to help them compare and understand the insurances that they are buying. They do this in 3 simple steps. First, request your quotes online. Second, compare your options and ask questions. And third, apply risk-free. Be confident you have the right policy so that your income is protected. With discounts for doctors in training and some relaxed requirements during the pandemic, now is truly the best time to request your disability insurance quotes with Pattern at patternlife.com/partner/PGD. Again, that's patternlife.com/partner/PGD for Physician's Guide to Doctoring. Dr. Monique Tello, thanks so much for coming back on the podcast.
Thank you, Bradley, for having me. And call me Monique.
Okay. So you wrote the book, Healthy Habits for Your Heart, which included the psychology of habit development. So let's do just a quick intro into some of the keys to successful habit development.
Absolutely. So I wrote Healthy Habits for Your Heart because I became very frustrated as a primary care physician. I wanted to help my patients to adopt just lifestyle changes that would lower their risk for disease. And I couldn't find anything good out there that I could just hand to them and say, here you go. If you just do everything in this book, you're going to be so much healthier. So I just wrote the book and I just made it very, very simple and straightforward. The first part is about how to change your lifestyle. It's basically an evidence-based lifestyle change guide. And then the second half is all of these very small, specific suggestions for habits that people can adopt to help them be healthier. And the main habit-changing tenets are going to be things like repetition. So just doing something very simple over and over and over again until it becomes rote. And that's what a habit is. You just don't think about it. It's a habit. If you have to think about it, it's not a habit anymore. So keeping things simple and repeating them over and over again. And that's, I would say, the gist of like the entire first part of the book.
And then the second part, you have those specific habits for having a healthy heart. Mm-hmm. But we need to pivot on that a little bit and use it more towards developing healthy habits to minimizing your risk of developing COVID-19.
Yes.
So using those same tenets of simplicity and easily repeatable, we need to figure out what using those principles we should be recommending for ourselves and for our patients. So what habits can we develop to minimize our exposure risk in a sustainable way? So what are some of the things that you're recommending to your patients?
Sure. And I'm gonna say it, there's two parts to this. So first is exposure risk. And that's very important. And we have had to, here in our household, really, we've had to drill it into our kids how to not expose themselves to COVID, but also how not to expose others to COVID. I mean, they have a healthcare provider mom who is working on the COVID wards. And if anybody's going to get it, it's me. If anybody's going to infect the neighborhood, it's my kids. So really early on in like mid-March, my aunt made a bunch of masks, the cloth masks, not the kind that would be hospital grade, but really good enough if somebody's wearing the mask to prevent transmission of a virus they may or may not be carrying to others, it's helpful. So we've just drilled it into our kids. If you're outside of the house in the neighborhood and there's any chance that you could run into somebody on the sidewalk or just around, you need a mask on. And so the kids, they just know if they're going outside, even around our yard, because we live in a neighborhood with like tons and tons of families. And the kids usually are like a roving gang, but they're not allowed to do that anymore. But they do. They run into their friends, and they know now they have to have a mask on, and they're really good at social distancing. Like we've kind of drilled it into them that and it's not only that we don't frame it such, you don't know what other people have and they might give you something. We framed it, you might have something that you can give to other people, and that really helped their determination to get it right. And they haven't had a problem with this. Like we just were running all around the neighborhood. They were on their bikes. I was running to keep up with them. That's another habit that we have that we'll talk about is the daily exercise. But they have no problem with putting a mask on and then their bicycle helmets, and then they keep them on. And even if the mask slips, like they'll stop and they'll adjust it because they know it has to cover their mouth and their nose all the time. And they're great about it. And they know that if somebody's coming on the sidewalk in the opposite direction, I tell them it's your job to pull over and to let other people go by and make sure there's 6 feet between you at least. Using 6 feet is it's probably not super scientific, but at least there's some distance between them and other people. And if we run into people, we try to say hi from across the street. I'm sometimes occasionally having to say social distancing, guys, remember social distancing. But for the most part, they've been very good about it. And I think just making it like a hard and fast rule, this is what we do. It's not just for our protection, it's for the protection of others. And those are the things that have really helped us to be able to do this as a family.
Yeah, I like that. The framing it as it's not for you, it's for other people. I mean, as much as humans in general are more like, focused on the self. Oh, I feel fine. No, I can't get it. No, this happens to other people, right? Like the mentality of it won't happen to me, but I could have it be asymptomatic and give it to other people gives them a little more skin in the game, I guess, for kids in particular.
Yeah. And early on when I started, so I've been working with COVID patients since mid-March in both the outpatient setting and then more recently in the inpatient setting. And I just had to sit down with them and be like, there's a risk that I could get this and, hopefully it wouldn't be bad, but there's a risk that you could get this. And what we know about this is that you may not have any symptoms at all, but you could give it to other people and you could give it to your grandmother or your grandfather. So we just have to be really careful. And this is what you're going to do. And it's going to keep everybody safe. So that giving them some control and power over it, like if you're always wearing a mask and if you're always standing far away from people, you're really unlikely to get anybody sick. And I think that really helps that even small children, they're 8 and 10, they get it. Like they have some control over this. This is something they have to do. It's important for them. It's important for others. And it's a habit at this point. It's completely like ingrained. I don't think they'll ever go outside without a mask.
You're in Massachusetts. I'm in New York. And one thing that I love about the New York recommendation is the simplicity, which is right what you said about the importance of developing a habit. And they said, if you go outside, wear a mask. Well, what do you mean by outside? Outside, wear a mask. Well, what kind of mask? Doesn't matter. Mask. Outside, mask. That's it. That's all you need to know. If you're doing that, you're fine. If you're not doing that, you're wrong. Like simple. Simple. Outside equals mask,
Yeah.
period. And I like that about it. You go outside, you wear kind of like you go outside, you put your shoes on, right? You're not going to go outside without pants. Well, now you go outside, you put a mask on. So simple. Are there any other like simple, sustainable recommendations? Like, for instance, do you do the grocery shopping for your household?
Sometimes. So
sometimes. Okay. So what's your protocol for leaving the house to do grocery shopping? Like, how do you make sure you're minimizing your exposure and the exposure of your family when you go grocery shopping? And how are you telling your patients how to do it?
Yeah. So all of my patients, I tell them you really should wear a mask all the time, always when you're outside. Same as we do. Grocery shopping, luckily, here we're in Boston, and a lot of the grocery stores have done a really good job about sort of enforcing or guiding people. I wouldn't say enforcing so much as guiding people towards social distancing. You know, they've got these spaced out marked areas where you have to wait in line 6 feet apart minimally to get into the grocery store. They only allow a certain number of people into a grocery store at a time. You know, this is probably happening everywhere, but like they're trying to be really careful about it so that people get the message. Even people who maybe are rebelling against this, they have no choice. They have to wait in the X marks the spot, 6 feet away from other people in line. They have a pretty good idea that they shouldn't be too close to other people in the store. And they want people to just keep moving. Get your stuff and get out because nobody else can come in until you leave. Keeping the minimal amount of people in the space, and everybody wears a mask. And they usually, a lot of the stores around here offer alcohol-based hand sanitizer, which is nice. So they'll have like those Purell stations all around and sort of be enforcing that. And that's one of our other habits. Everybody has to wash their hands. I am insane about it. Try not to touch your face if you're out and about. If you haven't washed your hands, you can't touch your face, kind of thing. And that's hard. I wear glasses. Like, it's really hard not to touch your face if you wear glasses because people know you're just constantly adjusting them. It's just what you do. It's really, really hard to not touch your face. But once you get in the habit of like, I haven't washed my hands, I can't touch my face, it gets a little bit easier. You just sort of get in that mindset. And
that's what I'm telling patients with regards to gloves. I think gloves kind of muddy the waters in terms of
gloves.
like,
I tell people don't even.
Are they clean or are they dirty? Yeah, exactly. So I have patients that are coming in and they're wearing gloves, and I'm letting them know it's hard to keep track. Are your gloves dirty? Are they clean? What can you touch with your gloves? What can't you touch with your gloves? And if you're using your hands, they're either dirty or they're not. Mm-hmm. Like, you either just wash them and then they're clean, or they're not. Mm-hmm. And that's the simplicity. Okay, so are you telling your patients when you go grocery shopping, don't wear gloves, but like wipe down the groceries, like get rid of the bags? What's the protocol there? Again, we're trying to be simple, and because we're going to have to do this for months and maybe years.
Yeah.
What's the process?
I looked at the literature on transmission of COVID, and I wasn't convinced that objects were a major source of infection. My husband disagrees with me on this, but he's medical. So he's big into like bleach wiping down things that come from the grocery store. I personally don't care. I figure if you wash food normally, like fresh produce and stuff like that, before you eat it, right? I mean, you rinse it, you wash it. You don't need to wash it in bleach. I don't believe that. I think most groceries, pantry items, and refrigerator items are going to probably sit for a while before you use them anyway. So there's going to be time for the virus to die if it's there. And you should be washing your hands before you put them away. So that really should take care of the problem. So I'm not
I also think there's an element of risk. Like, how many people touch a doorknob in a given day versus how many people really touch that carton of milk before you put it in your shopping cart. Exactly. Right? Like, the guy who put it on the shelf, and then the person who put it on the truck. Yeah. And those were very like spaced out in terms of time, and then you and maybe one other person. So the likelihood that any of those people put virus, from their nose or mouth onto that object is very low. Whereas, a doorknob, there's so much traffic, an elevator button, there's so much traffic. So I think, for me at least, it comes down to risk, right? You can't negate your risk. You're trying to minimize your risk. And that wiping all that's not sustainable. You can't do that for months. You're not going to do that for months. So if you start slipping up, that's not a sustainable habit. You need to have habits that are sustainable, which is leaving the house without gloves, making sure you don't touch your face. So let's talk about that. Let's talk about not touching your face. Like, how do you break the habit of touching your face? Like, is there anything that you're recommending to your patients about, like, I don't know, maybe we should be sending lots of the patients to the ophthalmologist to get LASIK surgery now, so they don't have to wear glasses and touch their face anymore.
I know, it's really hard. I think, and you're a surgeon, so it's probably easier for you. Like the whole don't touch anything with your hands once you've washed them concept, you don't break sterility kind of thing. But
I'm in a gown and gloves with like lights on me and a headlight. Like, I'm in an environment where I know, and there are constant reminders around me, like I shouldn't be touching anything, right? There's the sterile field. But I'm not so I don't know if the surgeon thing really gives me any type of advantage, because when I'm in the grocery, I'm not like, I'm not in that frame. I'm not in that place. There are no cues, right? So I don't know. I don't know how to. I think that's where the mask is advantageous. And again, the gloves are disadvantageous. I think a thought could be, fine, the gloves are a reminder to stop touching your face. I tend to think they're more of a false sense of security, whereas the mask is a reminder. Yeah. Like you get up there and you're like, oh, there's a mask in the way. Oh,
yeah, I think the mask helps a lot.
Because I touched the mask.
It prevents people from picking their nose, which we know everybody does, right? So it prevents people from doing that. It prevents people.
As an ear, nose, and throat doctor, I can confirm that.
I know. Yes, you have the evidence.
I see the fingerprints in there.
And from biting their nails and all that stuff. Like, people don't think about this. But if they have their nose and their mouth covered, I think that really helps a great deal. And then just one thing I tell patients when they're worried about the groceries, because I get this as a primary care doctor, I get this question all the time from my patients. Do I need to wipe down my groceries? Do I need to soak my apples in bleach or whatever? Like, no, because just picture this, like the only way the virus on the apple, like let's say somehow virus got on the apple, the only way that's going to get into you, if you touch the apple and then touch your face, like stick your fingers in your nose or your mouth, or if you eat the apple like right away without washing it, which you're usually going to wash the apple just with water, like that's going to take care of it. Don't worry about it.
Yeah, like the inside of the orange hasn't touched anything.
Except your hands. So you hold your hands.
Yeah, except your hands, yeah. So wash your hands, wash your hands and then eat your orange, yeah. That's an excellent point. I think more, there's like people wiping down cartons of milk and things like that. Okay, so what about, so we've covered leaving the house and going to the grocery store, but what about when you go to work? Like let's talk about outpatient first before inpatient, right? So you've been doing some telehealth. Have you been seeing patients in the office as well, or are you doing strictly telehealth?
So I've been working mostly in our COVID outpatient operations, which sounds very much like ERT, outpatient. It's very exciting, but it's not. So we have these respiratory illness clinic evaluation centers. Anybody with anything that might be COVID comes in and we see how likely it is if it's COVID. If it is, like, we can offer testing or get a chest x-ray, make sure that they're okay, or treat them if we think it's allergies and asthma, which unfortunately is a lot going on right now. Yeah. And at this point, we're able to wear an N95 for those clinic sessions. And that's pretty critical, I think. And we didn't at first, we didn't have them. We were doing surgical mask only for the first few weeks of those clinics. God. Yeah. Somehow not to get sick. I'm knock on wood. I have not been sick yet. Haven't been antibody tested. Haven't been sick. So now an N95, eye protection, and gloves. The N95 we keep on, same N95 for the whole clinic session, and then it gets either or recirculated after it's been decontaminated in this hydrogen peroxide cloud.
So you're wearing the same mask the whole time?
Yep. And if you need
How many hours straight are you wearing?
So for those sessions, it depends. They're about 6 hours. Yeah, 6-hour shifts. At first it was 4-hour shifts, and then there was too much handoff going on. There was too many docs rotating in and out, so they made them 6-hour shifts. And it's tight. Those masks are tight.
So I wear one in the office as well. How are you donning and doffing, or is it just the same gear the whole time?
It depends. So, and then it's a whole different story on the inpatient wards. But outpatient, they want you to just put your mask on and just keep it on. If you do have to leave for some reason and then come back, There's a fancy way to take off your mask where you don't touch the front of it, because you've kind of had your face in patients' faces and they've been coughing. And so the front of the mask is presumably contaminated, even though you might have had a face shield on. So you take it off very carefully from the back, the straps from the back, and you place it usually in like a emesis basin. There's a whole bunch of basins around. You can put your name on it so that everybody knows that's your mask. And then you put your surgical mask on and then go do what you have to do. And then when you come back, you put the mask on very carefully without touching the front of it. It's tricky, but there's like a way. There's methods. Everybody has a method.
So what about when you get home?
Yeah.
What's your protocol?
Yeah. So the clothes I've been wearing. So it's really funny. So prior to this, I'd say like before March 10th, if I was going to go see patients in any clinic setting, I'd dress nicely, wear like nice slacks, blouse, whatever, dry cleaned. As soon as this
stuff
started,
that needs to be dry cleaned.
I know, totally. As soon as this started, they were like, wear scrubs or, just very comfortable clothing, because you're going to be wearing the gown, the paper gown or the cloth, whatever your institute is using for it. And it gets hot. And you've got this mask on and this face gear. It gets hot. They're like, wear a t-shirt.
So you're wearing sweatpants.
Basically, sweatpants or scrubs. Mostly scrubs. I like scrubs, but and some people wear scrubs and a t-shirt, whatever. Nobody cares anymore. It's like it's gone out the window. People show up with Patriots t-shirts, like whatever, because you have a gown on. It doesn't know what you have on, right? So that's really funny. But when I get home, especially at the inpatient wards, because I feel like I have COVID crawling like all over me, and this is true for all healthcare workers all over, and you too probably, you strip down in the mudroom. Basically, like you're stripping down. You hope nobody sees you. Nobody's allowed to touch. Family's not allowed to. So I get from work, and usually I'm in scrubs or something like really easy to take off. I take off everything in the mudroom. I take off the shoes. I leave them there. I actually always wear the same pair of Danskos. They're like my contaminated shoes, and I don't touch them until I have to like put them on for work again. Strip down everything basically except underwear, and then roll everything in a ball. Drop it in the laundry. Run the shower. And suds up big time, because I've read this a few places actually, that the lipid layer, the outer envelope protein layer of this virus is very susceptible to soap, just plain old soap, which makes sense. And so just soaping up my hair, anything that might have virus hiding in it, just to be careful and sure.
Yeah.
And then after I've showered and dried and I'm like in new clean clothes and everything, then my kids can hug me. But until I'm showered and everything, they can't touch me. Just in case.
Yeah. I got home from work today, and of course they're running towards me, and I had the opposite response that I always have, which is no, like get them away, turn the TV. Actually, what I said when I got home today was, somebody turn the TV on now.
Yeah. That's a very effective distractor.
That's the only thing that'll get them to run in the opposite direction is the TV.
Yeah. SpongeBob. Put on SpongeBob. Okay.
So is it any different when you're getting home from the wards? Although I would imagine stripping down, getting right in the shower, it's hard to get any more dramatic than that.
Yeah, no, it's always, because it's with COVID. My whole clinic sessions, whether it's outpatient or in, is just off.
Yeah, you're dealing with high risk patients either way. It's not like you're seeing most of your primary care patients, your primary care clinic patients. This is not usual times for you. Although I wonder what your protocol will be when it is back to you're seeing your regular patients, and it is, you might have had an asymptomatic patient or two run through without knowing it. Any thoughts on that? Any thoughts on what your protocol might be down the line? Maybe a month, hopefully, a month from now?
It's what we're doing now anyway. So that our clinic largely shut down to in-person clinic visits, but we still have to see some people. So because I volunteered to work with COVID patients. Not everybody in my practice is able to do that. So we have some docs that just because of age or other medical issues, like they didn't want to be surrounded by COVID. So they're our skeleton crew in our clinic, and we screen as well as we can for patients who have acute issues. Like, for example, I know one of my patients was seen today in our clinic by a colleague because she had a laceration. She banged her shin, and she's got a big gash, and it might be infected, and she just has to be seen. You couldn't do that over video for many reasons. There's other complications, but anyway, long story short, she came in. And we don't know, could she be an asymptomatic carrier of COVID? We don't really know. So all patients now, the providers are wearing a mask. I believe they're wearing N95s in our clinic. Patient isn't necessarily a COVID patient, just in case, just to be sure. And the patient's surgical mask, which is it just makes sense. It's safer for everybody. You don't just take that out of the equation. You don't have to worry about it. So it's full precautions, or at least, most precautions. I don't think they're doing full gowns and gloves, but definitely the N95 just in case.
Yeah, that's a good idea. That's a good idea. We're doing something similar. We're doing N95s if you're, say, scoping someone. So you've got a higher risk procedure, or any type of procedure where there might be aerosolization of mucus, and a surgical mask otherwise. Mm-hmm. So everyone's wearing a surgical mask, and then you'll put on your N95 but that's just because they're in short supply. We don't have that many.
Yeah, so we lucked out.
We got a ration.
Probably saw that. We weren't using N95s for every even COVID encounter until the Crafts flew to China and picked up like 1 million N95 masks and brought them back over here, which is great. We're very appreciative. That was a good move. And then all of a sudden we have them. So but they're being recycled. So I don't know if you guys are doing this in New York, but they collect all the N95s at the end of the day and they decontaminate them in this like hydrogen peroxide chamber, and then they recirculate.
Yeah, that's interesting.
Yeah.
That's interesting. Yeah. So what do you say to your patients that come in asking about, say, and I guess this wouldn't really apply now because they're coming in with these upper respiratory tract infections, but when you get back to your office, right? Things get back to not normal, but we don't have quite the surge that we have. So you're back to your office hours, and your patient asks you, what can I do to boost my immune system? Now my thought on this is, well, actually, this does get into the habit issue because, right, what are the things that do help the immune system? And you feel free to correct me if I'm wrong, but sleep, physical activity, a balanced diet, and minimizing your stress. Mm-hmm. So all of these things, you can work in habits that can help these things. Obviously, that's not what they want to hear. What they want to hear is the latest berry that is going to boost the immune system, or a vitamin or something like that. So I don't know how you work this into what your paradigm is, but what is it that you would tell patients that are looking to boost their immune system?
Yes. So this was a question for COVID. Totally, always would get this question, and always very often would be accompanied by a link to some supplement that was being peddled on the internet, and they'd say, I want to boost my immune system. What works? And what do you think about this supplement? Like, this is just such a common question. But I would tie this also, my answer to just basic healthy lifestyle. Like, that's what's going to boost your immune system. But that's also what's going to keep you from getting COVID. We know, and I really emphasize to patients, like, the people that get sicker are people who have a lot of lifestyle related diseases like obesity, diabetes. Definitely diabetes are huge. Like, that's what I was seeing in the inpatient wards, was patients with obesity, diabetes, and then hypertension, heart disease, like a lot of related things. So I sort of put it all together in my answer to patients. Is like, everything you can do to boost your immune system is going to help prevent or treat, like if they already have these things, and treat the conditions that would make COVID worse if you did get it. So let's just do these things always. Let's always eat lots of plants. Let's always get lots of exercise or activity. Let's think about how you're going to get more sleep. And this sort of leads into a healthy lifestyle conversation.
So how are you working it in your own life? Because, the way I see it is wake up, kids, patients, kids, sleep, repeat.
Yeah.
Right? So how are you getting physical activity in there?
Yeah. So this is welcome to my world. I could talk about this forever. So we're ingraining in our kids, they have to be active every day. And we've had some rainy days, like monsoon days this spring, and we haven't been able to go outside. So the kids know, we're going to put on music and we're going to wave around and we're going to dance. We are very lucky. We have a Peloton, which is a very addictive thing, by the way, for people that already have a Peloton. I know what I'm talking about. For people who are on the fence and are lucky enough to be able to consider buying one, go buy it. Just get a Peloton. They're amazing. And the kids use it. I mean, I've got an 8 and a 10-year-old that get a kick out of this. It's like amazing. We have a room with yoga mats. We'll do family yoga. We'll stretch out. Like they know at some point of the day, I'm going to say, what have you done to move your body? And that's really the question.
Do you have, and I'm asking for myself, do you have any particular yoga videos or things that your kids are into? Because my kids, my oldest is about to turn 4.
Oh!
And I have 2 younger than that. So they're very close together.
Wow.
And so the almost 4-year-old is getting it. My wife found this thing called cosmic yoga, which is this Australian woman who makes these videos and she'll walk you through these different scenarios. And now we're underwater and we're talking to this person. Let's call him on our phone. And she'll like put her foot up to her ear and she goes through these, and it's great and it's engaging.
Yep.
And he's getting into it. And he's, we're doing it together. Yep. But so do you have any favorite yoga video that your 8 and 10-year-old wouldn't roll their eyes at?
So they actually, this is what works for us for the age they're at. They lead the yoga class for us. They tell us what to do and they get the biggest kick out of this. Oh. So they make us do all kind of ridiculous moves and positions and they laugh and stuff. And I'm like, who cares? That's fine. You tell me. Yeah. They know the moves. So they do yoga at school and it's just public school, but they do yoga. Hey, like a thing. Yeah. And so they know like the moves and get a kick out of it. My daughter led also in indoor calisthenics because they do indoor recess sometimes. And they also have to do, burpees and jumping jacks. And there was one rainy day she led, she got to choose the music. We call it indoor exercise class. She chose the music and she chose the moves. And I did whatever she told me to do for 30 minutes and she kicked my ass. I mean, it was hard. Oh, yeah. I was sore. I'm sure. It was hard. So yeah, I say letting them take the lead and let them direct you when they can, but they get a kick out of it and it's exercise. It's bona fide.
What about me time?
Yes.
How do you get your me time? Because, mental health in the age of COVID-19 is going to be a huge issue. And I'm sure when you go back to more regular office hours, you're going to be seeing, as if you didn't see enough already, you're going to be seeing a lot more. So in terms of making sure you and your patients are looking after our well-being, our mental well-being, how do you make sure you're incorporating that into the day? How do you make a habit out of looking after your mental health when you spend all day looking after other people?
Yeah, it's so critical. And for me, like as a working mom, and I sort of made it through the very little kid stage, and I had to learn the lessons then. Like it was hard. My kids were littler to prioritize me, but I learned pretty early on, like nobody else is going to do that except me. So I better do that. My trick is often I wake up really, really early. Like that's just my thing. Nobody's going to be awake in this house at 5 or 6. I'm not saying I wake all the time, but I'm usually up 7 at least, if not earlier. That's when I exercise and I'll get on the Peloton or I'll go for a long run and it's really healing and it's really good for me. So that's one thing that I do. Another thing that I'll do is I work in like little walks. Like I park pretty far away from the office when I go. Mostly like it's kind of a win-win because I get a walk in. It's nice. Boston's a nice walking city. I'll get it, even if it's crappy weather out, like I'm getting a walk outside in a pretty nice environment. So building in like exercise, which for me is like me time and healthy healing time. And then the other thing I do is I journal and I write. And like I'm pretty insane about journaling and writing a little bit pretty much every day. And that's usually bedtime after the kids have gone to sleep. So after the kids have gone to sleep, they've been going to bed a little later these days, which isn't a great thing, but they still are asleep before I am. And I still get in my journaling and writing time. And those are the things I have to do. Like I know I have to get my outdoor time in. I get my walking in, running, something, Peloton, anything. And I have to write because that's like when I reflect. That's like when I process. So those are things I have to do, but everybody's different. Other people's me time is might look a little bit different.
Yeah, I remember my sister-in-law once posted on a Facebook. Someone had said like, I'm on vacation and I'm doing X, Y, and Z exercise, and she said, "You're on vacation. Why are you exercising? That's not vacation."
Oh,
So, but whereas for me, like this is what I look forward to
yeah.
doing. So, for some people it's that, but I think it's also how it's perceived. Like it also depends on the physical activity. Like you got to find what you like. And I think that's another key to it being a habit is like you found this Peloton thing that you love. That is something that you're therefore going to look forward to, which then perpetuates you doing it.
Yes.
So I think it's critical because we, as physicians, we can be so prescriptive sometimes. Like you have to get your heart rate to X, you have to do it for Y period of time in order to have a good health outcome. And the recommendation should just be find something physical that you like doing and do it.
Yes, and that's exactly it. I was talking to a patient yesterday who feels like she's been very sedentary. She's a master gardener. She gardens. I'm like, gardening's pretty active. I mean, if you're starting up a large spring garden, you're going to be hauling dirt around and schools, and you're going to be like kneeling and getting up and kneeling and getting like you're moving around. If you're master gardening, if you've gardening and you're doing this at a high level, like an hour or more a day, that's a lot of activity. And she thought about it. She was like, "You're right. I guess I'm not."
And you're not, and you're not giving yourself credit for it. And then you'll let yourself do it for longer. Be like, you know what? This is my indulgence. I'm letting myself take an hour today to garden.
Yeah.
And then if you frame it as also, well, actually, this is also my physical activity.
Yeah.
I'll do it for another half an hour. You know what? I'm really enjoying myself out here. I was going to go back inside, but you know what? I'll stay here outside. So just fostering that and giving our patients that positive reinforcement that stuff
it counts.
is better than they even realize that it is.
Yeah, and housework
and then
counts.
they'll feel better about it, and it'll help their mental health because they won't be stressed about the physical activity that they're not doing, and then they realize they're doing it. And I think there's a lot baked in there, a lot of positivity baked in.
Yes, positive thinking. And ensure that they realize it doesn't have to be quote unquote a gym workout. It can be like housework. If somebody does an hour of vacuuming and bathroom cleaning, and that's heavy duty, like that's actually, you sweat doing that. Like I say that counts.
Yeah. I think it's important to recognize it's physical activity, not exercise. Right. Like exercise is a very specific type of physical activity.
Exactly.
But it just needs to be
moving your body, which is how we frame it with our kids too, is did you move your body today? How did you move your body today?
And there were a lot of different recommendations in your book, exactly 100, actually. Are there any that you can recall from your book that are more relevant now in the age of coronavirus?
Yeah, for everybody who's working at home, sitting is still the new smoking, and making sure you build in breaks from sitting. So, or even try to figure out a standing desk situation at home if you're going to be on Zoom. So many people are on endless Zoom meetings with work, or they're on their computer, or they're making phone calls. I have a bunch of habits in the book about walking when you're on the phone, pacing when you're on the phone, or standing desk, or taking breaks during your sitting workday where you get up at least once an hour and stand or walk or move. So avoiding the sitting position when you're at home. I think it's harder when you're at home because you feel like you're at home. You should be able to just sit, but that's not good. So definitely paying attention to that would be one thing for the work from home crowd.
Yeah, I have a neighbor that I have a feeling he's working because I see him walking around the block and he appears to be talking in such a way that it looks like he's taking a meeting. Yep. It looks like he takes his meetings while walking around the block.
So brilliant. That sounds brilliant. I love it.
And I think it's got to be good for other, like your creativity and your like there are so many ways I think that could be more advantageous than sitting at your desk.
Absolutely. So it's something that people can do. Another is one thing that we did, we joined a CSA, which is in my book too. We've never been part of a CSA before. Now, CSA is Community Sustained Agriculture, I believe is what CSA stands for. But regardless, it just means a big, huge box of produce shows up on our doorstep about once a week. and it's a great way to try new produce and to make sure that you always have fresh fruits and vegetables in the house. And it's we're supporting it's a CSA that popped up because the farm's usual customers were restaurants. And they all of a sudden, like within a week, all of their business dried up, and they put on their website, we'll deliver to houses, households want to sign up for this, and all of a sudden we're part of this. So we're kind of helping them out, helping out that sector of the economy, and we're getting all this fresh produce. And it's actually it's less expensive than the grocery store. And it's a pretty big haul of, like, there was more kale than we knew what to do with this week. We had kale like 3 nights in a row. So that's
of course, the doctor that wrote a book about having a healthy heart is talking about all the kale she has in her house.
Yeah, it was like bunches and bunches, but we figured it out. We ate it. It was good.
I had an interview a couple episodes ago with an economist. It might be a couple episodes ago. Things are getting all jumbled up now about shelter in place and how long he expects we're going to do it. And one of the things he had talked about is businesses are either going to be able to pivot or not. And if they're not able to pivot and live in this new existence, then they're not going to make it. And so the fact that the CSA is, previously, they were able to pivot and deliver to homes in such a rapid way really is a testament to their ability to continue to survive. They found it, well, who needs produce? Who doesn't want to go to grocery stores? Like fine. No, not going to restaurants. We'll do it to individual homes, and I think that's a great thing, because that's going to help people's health, right? It's going to minimize their exposure to the outside, so it's going to prevent more transmission. That's amazing in so many different ways.
Yeah, it's a win-win, and there's definitely a bunch of businesses that have been able to do that. There's a bakery that used to cater mostly to restaurants that's now doing home delivery. It's like a high-end bakery. I think people are smart. Human beings are smart. I'm hoping that we can come through this with that kind of innovation and sort of reframing things.
Yeah, I think there are going to be a lot of changes that end up being permanent afterwards, because we just figured out that this is actually a better way to do it, and the system had to break in order to discover that. Yeah. So for healthy habits in the age of coronavirus, do you have anything that we didn't touch upon, either things that you're recommending to your patients that are simple and sustainable to help them either minimize their exposure or improve their health given our current circumstances, or that you're doing yourself?
Yeah, so I'm sure there's some that we didn't think of. I will say in my book, I mentioned it's one of the habits is to hang out with a furry friend. So the power of pets, basically, and we are adopting a dog. That's one of the things that we're doing.
There are dogs left. I thought they all got adopted. Like, that's become such a common thing. I can't tell you how many people I know that are adopting pets. So you guys are doing it as well.
We are. And I think,
so how does that help your health?
Yeah. So there are studies that show people.
They're not vectors of illness?
No, apparently not. So we're adopting a rescue dog. We submitted the application and passed the first hurdles for a 4-year-old Greyhound mix named Jeter. And I know,
like the Yankee.
Yeah, I know. But we're accepting. We're Patriots and Red Sox fans here. But we'll stick with Jeter because he's respectable. But anyway, I think it's going to help us. And I think this is why owning a dog is associated with better health outcomes generally. It gets people outside. Usually you have to walk a dog or at least take it outside and throw a ball or a stick for it. And a lot of people walk a dog. So you end up walking more. And every step you take is going to help your heart. And then it's stress reducing, just petting an animal or just, talking to an animal. I swear to God, it brings the heart rate down, brings blood pressure down. I tell some of my older patients with health problems who can't get out much, consider adopting a senior animal from a shelter because it's a total win-win. It can benefit you, benefit the animal. So that's one of the things that we're doing since my husband is working from home a lot and the kids are home. It's like the perfect time to introduce a dog into our family.
Interesting. I wonder if there are parallels to that that are similar to socialization. Like people that have larger or tighter social circles tend to do better health-wise. And I wonder if having a pet is similar in that regard.
Yeah, well, there is something,
right? Another person to talk to, another person that depends on you. It's a healthy
relate. They're non-judgmental. The dog is not going to judge you. It's like
unless you're projecting your own insecurities, and then maybe the dog gets a little judgmental. You did not see me eat that. I did not. That didn't happen.
Well, the dog's excited. The dog's just like, give me some cheesecake. Come on.
Yeah, I want some too. Yeah, I'm not judging you. I just want some. Yeah. Just leave a little bit for me and we'll all be friends. Okay. So that's really wonderful. Well, listen, I appreciate you taking the time to do this, considering the world has turned upside down, your life included.
Mm-hmm.
You're between stints on the COVID wards inpatient. So thank you for taking care of all those patients and giving us some great advice on how we can have some simplicity in our lives and find ways to really increase our physical activity, keep ourselves safe, and all those little habits that we're going to need to continue for quite some time.
Yeah,
now.
I think everybody's going to be wearing masks for a while and washing their hands more and using hand sanitizer a lot more. I think those might be here to stay and just universal.
And I'll see if I can get my 4-year-old to lead a Zumba class.
Yeah. Oh yeah. Trust me, it's a workout.
All right, Monique, thank you very much.
Thanks, Bradley. I appreciate it.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. He can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, please be sure to leave a 5-star review on your preferred podcast platform. We'll see you next time on the Physician's Guide to Doctoring.